See, he's carried at 3, but square root pi. That's 18 million dollars.
Square root. Never know what you're going to say. Never do.
You're listening to the Help Me with HIPAA podcast, where HIPAA and humor collide to make learning fun. Your delightful hosts are Donna Grindle and David Sims. Relax. HIPAA help is on the way.
Welcome to the Help Me with HIPAA podcast. My name is David Sims. I am from HIPAA for MSPs, and joining me today, as always, is Donna Grindle of Cardin Compliance. So, Donna, are you catching those Pokemon?
I haven't had an opportunity to play yet, but I'm going to be playing this weekend because my nephew's on the way, and I'm a very good aunt.
Well, I did the whole eat your words thing. I told somebody that I have no time for that stuff. I'm too busy. And then like 2 days later, my kids are like, will you please play with us? And I'm like,
that sealed your fate there, brother.
Okay. Yeah. And I have, upper end teenage boys, not little 8-year-olds, but they're wanting to run around and play. But you know what? It's like I mentioned before, if it'll get them from in front of the TV playing video games to out there walking around, then I'm all for it. So
it's a really cool phenomenon for the summertime.
Yeah.
It'll be interesting to see what happens in the depths of winter. But
yeah. Well, I don't know anything really about the Pokemon, so when I catch one, I'm like, okay, is this good or bad?
Yeah, it's catch and release.
Yeah, what does this thing do? And I have no idea.
Yeah.
But being competitive as I am, I'm like, I'm going to catch more than you are.
You don't know what you're doing, but you're going to do a lot of it.
Yeah, all I know is that I'm going to be a higher level than my kids because I have something they don't. It's called a vehicle.
Oh, God. Well, all right now, it's just a matter of time before some really, out there madness happens after that video you showed me of like thousands of people going after some creature that had spawned in Central Park. It's like, wow.
Yeah, we'll have to try to put that in the show notes if we can remember. Yeah. That was just crazy.
All right.
So the Pokemon we'll be talking about today happens to be in Oregon. There's a resolution that recently came out, and we like covering the resolutions. Our listeners like covering the resolutions because they tell us. So we're going to take a look at this one because with all of them, there are unfortunately similarities and there are differences. Unfortunately, with this one, it involves yet another stolen, unencrypted laptop.
Yeah. And hopefully we're going to get out of those because this one goes back to 2013 when it was stolen. Mm-hmm. We just, I think, finished the 2012. Maybe not because I'm pretty sure there's probably other ones that are still sitting out there with the rate this takes, So here we are. The whole thing started March 23rd, 2013 for Oregon Health and Science University.
So basically what you're saying is if you want to know about the breaches that have happened this year, you need to join us in 2019.
If you want to see what happened, it seems that might be the case.
That's a cliffhanger there, buddy.
For continuing drama.
Yeah.
I guess it really started happening before then because that's when they notified HHS of a stolen, unencrypted laptop. And then things, things happen because it had like over 1,000 patients on it. So then they got a notice from OCR on May 1st. So pretty quick turnaround, March to May. They're going to be investigated. And that investigation started. In the middle of that investigation, in July of 2013, they notify HHS of another breach because they realized they have been storing ePHI at an internet-based service provider cloud server without a business associate agreement.
You didn't want to make that phone call.
Can you imagine the one that figures it out? And how many people that, but you're under investigation, so they're having you pull all this stuff out, and that's when you figure it out. So you can't not tell them because it's coming out.
So that's when you do your risk assessment by proxy.
Well, and so they were already under one investigation, have the breach in July, and then in November they get notified, we're going to investigate the second one too. So that's all of 2013 was breach, investigation, breach, investigation. So here we are, July 2016. So a little time has gone by.
Yeah, not quite 3 years.
But over 3 years since the first one. So it's been going on for a while, and their settlement is for $2.7 million. And
then the worst part,
a 3-year cap. I mean, that's brutal. I mean, usually they're not 3 years. So that means that from March 2013 until July 2019, assuming everything goes right with the cap, they're going to be dealing with OCR.
Whew.
Yeah.
Golly.
That's going to take a while.
That's like a bad marriage. You just can't get out of it quick enough.
Yeah. It's like a prison sentence, isn't it? So
I don't know. I've never. I know some people.
We won't talk about that. It's not fair. So there were some very interesting things in this one, and the reason they came down on them is, when you read it, it's like, who was in charge? Is really who allowed this to continue even after problems started bubbling up. So I pulled out some things out of the press release that I thought were really telling on how OCR is starting to feel about these things. So this quote, you ready? This is from OCR Director Jocelyn Samuels. So
we need to get her on the podcast.
Hey, I wonder if we could do that.
Jocelyn, if you're listening, well, we know she's listening. They take a lot of their stuff from us. We want to interview you. Come on the podcast.
We'd love to interview you on our podcast. Please allow us. Let us know. Have our people call your people. Just tell us who to call. Our people, of course, is us. We'll hire somebody just to call you, though. So anyway, the quote is, from well-publicized large-scale breaches and findings in their own risk analysis. So they're reading about it going bad, and they're finding problems.
Mm-hmm.
They say that they had every opportunity to address security management processes that were insufficient. Furthermore, OHSU, Oregon Health and Sciences University, should have addressed the lack of a business associate agreement before allowing a vendor to store ePHI. This settlement underscores the importance of leadership engagement and why it is so critical for the C-suite to take HIPAA compliance seriously. Boom.
How many times we talked about that?
Yeah. Well, it literally says, who's in charge? No one's paying attention. The people in charge do not take it seriously. So that's why this has been such a stiff. And this is the settlement. Who knows what it would have been if it wasn't a settlement? And so in the press release, they make a point of saying they performed a risk analysis in 2003, 5, 6, 8, 10, and 13. But they didn't do anything to make sure it covered all of their enterprise. So first of all, they just did the risk analysis. They probably did
template.
Yeah, they probably did a template or ran one of those little programs and said, check, we're done. So it didn't cover everything and didn't identify all of the places that PHI exists, or they might have found the one that was sitting out there. And it did identify some things, vulnerabilities and risks in many areas, but they didn't do anything about them either. So they didn't address these things that they already found, and they didn't have policies and procedures. And it was just like, we're not doing it. So they did they did enough to think they were getting by.
Yeah, that's interesting that they did the risk analysis part, which is usually the hardest part we can get people to even start on.
Yeah, but they
did that multiple times.
They kind of did one.
Yeah,
and even in there, they said, we have a problem because we're not addressing the encryption requirements of HIPAA. Mm-hmm. It's documented in their risk analysis. And not only did they not implement encryption, but they didn't attempt to implement any other way to protect it. That's the big problem. If you choose, or for whatever reason you can't do encryption, you're supposed to find an alternative and well document what you're going to do to make sure you don't lose these unencrypted devices. They didn't do nothing.
So the risk management plan, which comes after the risk assessment, just didn't happen.
Well, maybe somebody wrote something down, but then they put it on a shelf. So, to us, that's always the big piece of we go in a lot of times and somebody will say, yeah, we did a risk analysis, and they'll dig around and they'll pull out some notebook somewhere and hand it to us, and I open it up, maybe the second or third person to ever open it. And it'll say, you're going to do this in May 2013. This was done in March 2013. We'll use their dates. And it says you're going to do a detailed risk analysis because what you have is not good enough. And you had a consultant come in and they pointed that out and said, in May 2013, you need to do this. Did you do it? And they went, did it say that?
Were we supposed to read that?
We thought they told us everything to do. So, yeah, did it really say that? Let me see. So that's what happens. But there's no one in charge looking over it and saying, is this happening? And I hope, but based on some of these violations that they detailed in their investigation of what they found and the details behind the dates that are on there, I was like, really? That's still going on? So, they're not moving forward. And now they've got this huge thing, and now they're going to have this cap, which we've reviewed caps before. And
which is a corrective action plan for our new listeners.
For those of you who aren't familiar with it.
For our thousands of new listeners this week.
But these corrective action plans mean, and we'll go into a few of the elements that are required, but that means for 3 years, OCR is overseeing your HIPAA compliance program. You're reporting to them, not your own leadership, because your leadership isn't getting it done the right way. So
that was a nice way to put it.
Yeah, I try really hard,
You did well.
So here are the 5 violations. So they found 5 violations. Sometimes they'll find 1 or 2.
This in any order of importance or anything?
And it's in the order in which they're listed in the document. So if they
and we need to have like a countdown roll or something.
Yeah. Oh, we have to do, like Letterman's top 5. No, but so number 1, they disclosed PHI and put it on a non-HIPAA compliant, business associate server. So they have the violation. So within that whole thing of putting this ePHI out on a server that is not HIPAA compliant, that in itself, that's a unacceptable disclosure, which created a breach. So that disclosure is a violation, of compliance requirements and resulted in a breach.
And I can tell you one way that several of our listeners are probably doing that very same thing.
Mm-hmm. Go ahead.
Because, when people listen to these shows, sometimes they're going, might think, man, I can't believe that happened to somebody, whatever. But, sometimes you need to look in the mirror or at least know where to look to see if you're having the same problem. And I've seen this many times. So I know there's got to be at least one person listening that's doing this. They're emailing PHI or ePHI, and they're not doing it encrypted, and it's sitting on somebody's server somewhere that you don't have a business associate agreement with, and they're not HIPAA compliant. It's happening all over the place.
Yeah.
And this is, and I'm not saying this is what this is. I don't think it says exactly how they were doing it, but that's one way I know of a lot of people that are violating the very same thing.
Yeah. I mean, that's just one of the cases that we've seen. And, to me, I hear people say, well, it's encrypted email, so I don't have to worry about it. But then they don't put controls in place to make sure nobody can hack into the encrypted email. Mm-hmm. So if I can get your password and get into your email, it doesn't matter if it's encrypted.
Yeah, and typically those passwords are not changed.
No.
They're very easy to get into.
Because it's a hassle.
Yeah, because it's not convenient.
Yeah. So, but the ones where the emails are done and, we get caught in those all the time. We give our opinion of this is what we think, but it's your business and you have to decide. So, yes, that's one of the many ways that happens. It also happens when people decide, oh, I'm going to share this big spreadsheet with somebody. It won't let me email it. So I'm going to put it out on Dropbox or Box or Google Drive or something like that. Mm-hmm. My own personal one, in fact. and I will get it to you that way. Or I'll share it with myself. That happens a lot. And so it could have been any of those cases or even something completely different. They could have made their own app and put it on because they say it's an internet service provider. So
they could have FTP'd it.
Any number of things.
Any number.
Yeah. we're not going to speculate on what that was. Although we do know ePHI ended up on a server that was not compliant. That is an inappropriate disclosure of PHI, a breach, and number one, the violation of what they counted in their failures of HIPAA compliance when they were doing this workup. So in their investigation, they found that. And then, of course, part of that is they didn't have a BAA with the ISP who had the server.
Seen that a few times.
Yeah. So they disclosed it. They didn't have a BAA. And then the third thing is they had no policies and procedures in place to prevent, detect, contain, and correct security violations. Now, all three of those separate items, those are separate violations of HIPAA compliance. Those violations all went on for over 2 years. So you got 3 violations involved with the fact that they put the data out on this server. So it's 3 different violations, and the data sat out there from January 2011 until July 2013. Okay, so that's going to come up again in a minute. So we got 3 violations over 2 years each.
Okay.
So 3 times 2.
Hold on. Let me pull up my calculator. So number 4.
So number 4 is, of course, the no encryption plan or equivalent alternative measures. But
that was for the laptop.
That was for the laptop. And here's the thing that really hit me. From July 12th, 2010 to the present. I'm like, okay. Really?
Which present?
I went back and checked that twice. I was like, surely, how did they not somewhere along the way address that? I don't understand.
So now we're looking at 6 years.
I don't understand. But you got to say to the present, and this is dated July 2016. So now that's 6 years, right? So we have 3 times 2, and now we have a 6 all by itself, right?
So we now have 2 6s.
Which makes 12. All right. Anyway, and then we have no policies and procedures from May 2013 to July 2013. So at least they have one that only went on for a few months. But this was no policies and procedures to address security incidents. Well, the reason they had to add them is because they kept having them. So they said, well, let's write something down so we remember to do it the next time. Clearly, we're going to be doing it a lot. So you had 3 violations over 2 years long, 1 over 6 years long, and then 1 just a couple of months. So if you do the math and you go back to the law that says they could do up to $1.5 million per year per violation. That's what it says.
So he's carried it 3, but square root, pi. That's $18 million.
Square root. Oh, never know what you're going to say. Never do. So $18 million. So the 2.7 sounds like a deal.
Yeah, I'd pay that any day.
Compared to the 2. You got a choice. The present. How is it to the present? That I do not understand. Why not, jump in there once you've had it and start doing something, but nothing. So we've got 2 cases of no policies and procedures, no BAA, improper disclosure, and no encryption or a plan. These are all, really and truly, the fact that a lot of this encryption was actually identified in their risk analysis, and they did nothing. So that's, in the world of technology, that should be low-hanging fruit. Today, especially. Come up with something. It's built in. The
bad thing about all this is when you look at it, these are all very, very simple fixes. It's not like we had a major hacking incident and or something that was like, wow, that would have been tough to prevent. I mean, this stuff is just basic, easy things.
And I think that's why they're coming down on them so much. Is like, you clearly just do not care. And they can't say it's really willful neglect because they had done something.
Yeah.
It was clearly very little, as little as possible. But, they did something so it wasn't a complete willful neglect kind of approach. But it was pretty close, based on how strict that, how stern they were in this announcement, which very few people have read, I'm sure. and really coming down on them, $2.7 million while, they ask for your financials so they know that they're going to hit you hard enough.
Mm-hmm.
And because they have to. If they don't fine you enough, then you don't care. You just stroke a check and it doesn't make you change anything. It's cheaper for you to just write that check. So that's why they're doing that now. So we get the $2.7 million, and then we get the fancy 3-year corrective action plan. And how my feeling is, if people talk about not enough guidance, and I always am a big fan of using these resolution agreements because they're full of guidance. They tell you what they don't like, and then they tell you what they want you to do on the corrective action plans. They put in there exactly what they're going to have these people do. So it really tells you everything you should know if you just read those resolution agreements. I think they're just so exciting. People are afraid to start. They wouldn't be able to put them down.
You think so?
I know you get excited when I ask you, have you read it?
I know. It's great bathroom reading.
Yeah. You always say, wait, you haven't read it for me? You haven't given me my Cliff Notes yet. I can't read it.
I know. That's that osmosis thing I have working for me.
So they started this corrective action plan. And first of all, I found it interesting that I've never seen time frames set the way these are, because we've talked about it before. There's like 90, 120 days. So their security management process, under their corrective action obligations, they agree to is their security management process. They're going to conduct the risk analysis and all the things you're supposed to. And then it makes a point of saying all systems, networks, and devices that create, receive, maintain, or transmit PHI. So they made that point of, well, you didn't even look at everything. You just ran some little program or did the basics or the bare minimum, and you didn't look at everything. We're saying look at everything. And that's, we did a whole point. We did a whole episode on where is your PHI? Are you looking everywhere? Where are your vulnerabilities on your network? Things like network printers and all of those kind of things. People have to think about those if you're going to really protect it. Clearly, these people did not worry about it.
I would say, too, to add to that, not only do you want to look at the systems and the networks, that create, receive, maintain, and transmit, but also what other people or vendors or they do the same thing. So you can have speaking to a lot of the smaller providers, they have an outside IT company come in and they're doing these things. They're doing the maintaining, sometimes even the transmitting of that ePHI. So that needs to be part of the security management process as well.
Yeah. It's an overall big picture of knowing where your data is. And in this particular case, it's a big environment and they have a lot of their own stuff. But if you're small, you're going to have to bring in all those vendors that are doing stuff, for you. And it's not uncommon. So then number 2, first they're going to do a complete and thorough risk analysis, which is already in the law, but they're telling them to do it. Then they're going to say they shall develop a comprehensive risk management plan. We know that goes with it. That's how it happens. And then they say specifically, it explains OHSU's strategy for implementing security measures sufficient to reduce the risk and vulnerabilities identified in the risk analysis to a reasonable and appropriate level based on their circumstances. Okay, that's what we talk about all the time, isn't it? Reasonable and appropriate, and having a plan. It doesn't say you need to fix everything. It says, what's your strategy? What's your plan to reduce the risk and vulnerabilities you've identified and make it reasonable and appropriate for your environment? So all of that together is something that you and I have gone off on multiple times.
And we'll continue.
I was like, are you going to say something more than Yeah. You go, yeah.
Yes, amen. Can I get a witness?
So, continues on with effective oversight of workforce members to assure their adherence to the rules and the internal policies, planned remediation actions, specific timelines for expected completion, which is, we talked about, you should be using, when we tell people, well, you need to have a project management system or controls in place. And they're like, why? Because you have to have timelines and plans and show that you have them. Okay, that's what it says. So, and they're identify the compensating controls in place in the interim. But then this is the thing that I thought was interesting is they have 310 days from the effective date to provide the risk analysis and the risk management plan, including implementation dates for the measures and the compensating controls and all that kind of stuff. You've got 310 days to do it and get it to HHS, who will then respond to you within 90 days based on their thoughts. So 310 days. What is that? Where'd that number come from?
I don't know.
Well, it bothers me and I need to know.
So you found out?
No, I haven't found out. I haven't had time to go figure out why 310 days. What math makes that work?
Maybe just because it was right before somebody went on vacation.
Well, it's not 365. So I'm just curious where we got, it's...
Well, they might use dice.
55 days, less than a year. I don't get it. Dice. Yeah. It's spin the wheel. Let's see what your cap is.
You're on red. Woo!
Maybe that's the way you could start getting your penalties. You win today. You're today's winner with $3.6 million.
That would make a pretty good show on TV, wouldn't it? The OCR show. Spin the wheel and see what your fine's going to be.
So
we digress.
Yeah, as usual. So then within that same 310 days of the effective date, at 2 years following the effective date, and at each subsequent year following the effective date during the term of the cap. I couldn't even do that math, so I just said a lot. They're going to, pretty regularly, they're going to have to update them regarding their encryption status, including, and I don't know if I've ever seen this mentioned before, specifically by OCR, they mentioned mobile device management solution.
That's interesting.
That's what I said.
I guess because it was, maybe because a laptop was involved?
You think? But, usually it just says you've got to encrypt it, but to actually put MDM in there and say that we want you to implement an MDM. And I know we've talked about it before, but why don't you give a little David overview of MDM?
A little David overview?
A little David. Not the big David overview, the little David overview.
Well, I mean, the MDM is mobile device management. And in its basic form, it's just the ability to manage mobile devices in a way that allows you to either locate device or encrypt the device, or sometimes you can wipe the device. You can put policies on the device. I mean, like for instance, if you kind of a really super basic form of MDM is included in most phones where, you can log into your portal for iPhone and then you can lock that phone, or you can reset the password or whatever. That's somewhat of a way they can do mobile device management. But if it's a complete solution, you can go in and say, I don't want these employees to be able to install software, or you can push out an app to all your devices. But anyway, it's managing that device typically through a platform so that you can ensure it's encrypted, it's safe, it's secure, and all those things.
Hence the name mobile device management.
Very good. Let me sum it all up. Yeah. It's the management of mobile devices.
So, but then here came item number 2 under encryption, and also a thing that I had not seen specifically stated.
Another 310 days.
Yeah. They got a lot to do in 310 days, and maybe somehow they calculated how much they were going to give them to do all of them and added them up. I don't know. So anyway, the 310 days come up with this encryption plan to implement mobile device management And you have to report on this implementation. And part of the status needs to include supporting evidence, aka you need documentation, as we always say, supporting evidence of their implementation of a solution to enforce encryption. And here's where it gets kind of interesting. On OHSU owned and personally owned devices. Laptops, desktops, and medical equipment is included, connecting to their secure wired and wireless networks, except for any devices for which they had granted exceptions to the encryption requirement.
That can get murky.
Yeah. So then I'm like, okay, well, first of all, they said personally owned devices are involved here. And all these other people are like, well, I don't want to let you have control of my phone, but I am going to access my work email on my phone because it's convenient for me. Well, it's not convenient for the company if they're going to have to pay millions of dollars because you don't secure your phone and you won't let them secure it. And this is OCR is saying clearly here, they expect them to make sure that the mobile devices, even the personally owned devices, are addressed. And the wired and wireless networks, and then they give them the granted exceptions. So immediately I thought, well, I know how many they're going to be.
All of them.
And then the next sentence says, if they granted an exception for the encryption requirement to any device, they will provide evidence of reasonable compensating controls that have been implemented on those devices. So you can't just say, well, we gave them all kinds of exceptions, so we're good with those. Let's don't talk about those. Don't look at those. Put those behind the black curtain. So they do have to also deal with those in some way. And we always talk about you don't have to have encryption, but you should document how you're going to make sure nothing happens to it.
Now, what do you think about the part of the phrase here where it says that the personally owned devices connecting to wired or wireless networks need to be managed? But does it mention anything about accessing ePHI on it?
Right.
And then the next paragraph down, it specifically states that if there's an exception, you have to provide evidence of reasonable compensation controls that have been implemented to protect ePHI on such devices. So it's almost like it's a little different there.
Well, how do you if you're not going to require encryption, then you have to say if ePHI is on that device, this is how we're going to protect it. So
Yeah,
encryption just means I don't have to worry about it at all, whether it's got PHI or not, and that's what they're saying.
Yeah, it just initially reads like if you're even connecting to the wireless network,
well, yeah,
then you've got to be encrypted, whether you do anything else or not.
Well, you think about if I have an infected device that I allow to be connected, and an encrypted device is going to be much more likely to not. Generally, if you've taken the time to worry about the encryption and you're managing it properly, if it has MDM on it, you're much more likely to not have that device be infected. Fair enough?
So coming from the aspect of a small provider practice, if you have Wi-Fi, it would be best not to allow Susie Q sitting in the lobby to access your Wi-Fi.
No, I would don't, because Susie Q, she may be a hacker. You don't know. Number one, but they should definitely have guest networks. None of this getting on the same network thing. No, nay. No. So yeah, you should have a guest network, a virtual LAN, something set up to make sure those devices, if you want them to have internet access but nothing else, then they can. And it's a separate network from what your ePHI sits on and travels on. So
yeah, or similarly, which is what I see often, probably more often, is that the employees have the Wi-Fi password, and so they can access Facebook because that's a necessary medical device.
Yeah, and it is a concern. I mean, I personally worry about people who allow their employees, they come in and hop right on the company Wi-Fi so that they can play their music, do their Facebook, all this other stuff. And, who knows what else they've gotten on those phones. I mean, we talked about how much you can do to them. Mm-hmm. So, imagine a really old Android device that's never been updated. What kind of trouble you could be in. And God forbid one of their kids took it and, did the
Rooting it.
and or jailbreaking it or whatever you want to call it, and now you've really got trouble going on. So, but the other thing under number 2 was they have to periodically test the effectiveness of the implemented solution on both OHSU owned and personally owned devices. And
that's why I got 310 days.
Yeah. And I do find it interesting that they do say, when they say personally owned devices, they do say in parentheses, laptops, desktops, medical equipment. But most personally owned devices that we think of are true mobile devices, tablets and phones. So they're not specifying those, but you got to wonder what that deal is. Because then number 3 takes you into a whole nother world of devices.
I have seen where certain places, especially where you have maybe doctors share an office space and they work kind of for a large conglomerate, but they have their own, laptops and everything. So they're not being provided necessarily by the quote unquote practice.
Right. So
I certainly see that often.
Well, they've got those included. And then they did, number 3 was both OHSU, that's hard to say, I'm sorry, owned and personally owned devices for removable storage, USB drives and portable hard drives. And we talked about letting people put things on there. And they do the same process of those with you can grant an exception for removable storage, but you got to have a way you're going to do it. And they shall complete initial deployment of a solution to enforce encryption for removable storage within 3 years of the effective date. So you got between now and when this all ends, but one of the things of you being out of the cap is that you got to have that done.
Right.
And then, of course, the next thing comes into security awareness and training, because if we had trained people, maybe they wouldn't have done all that stuff.
Yeah, and we give you free training, so there's no excuse for that.
Yeah, so the training materials, and I found it interesting, the training materials should also include privacy and security awareness related to the use of internet-based information storage services. Don't put things on servers that don't belong there. Disclosures to third-party entities that require business associate agreements. Yeah, you should teach them about that. Safeguarding the information. Managers, regarding managers' effective oversight of workforce members' uses and disclosures of PHI. So they're like, the bottom person that made the decision didn't know to even think about it. Their manager didn't know to think about it. We don't know where up the chain of command that somebody apparently finally knew about it, but it never got to them. So it covers all of those things, including the security incident reporting, internal policies and procedures that they clearly have to develop, password management, all of those things. And they shall provide the training materials to HHS for review and approval within 90 days of approval of the risk analysis and risk management plan. So you got 310 days to do the risk analysis and risk management plan. And then once they approve that, they're giving them 90 days to do the training on it. And I'm wondering, what you going to do that year? Hopefully they're doing something, because we all know they have been, but maybe this will get them to do it. But they have to provide documentation that all workforce members with access to PHI or ePHI have the training within 120 days. And here was a really interesting one. Now, this is, everybody get your pencils out, because people always ask this, and this gives you a specific answer. Workforce members will continue to receive such training on an ongoing basis. Yes, we know that. And new workforce member with access to PHI or ePHI will receive security awareness training within 15 days of beginning work. They'll say, well, I can't tell you the number of times people are like, well, we only do annual training. Well, when do you train the new employees? Whenever the annual training is. So if I have annual training today and somebody starts next week, they don't get training for a year. Well, yeah, that's probably right. Hello.
So we see here, we're looking at 15 days.
Yeah, 15 days. So they're making
it clear. Is that business days or is that calendar days?
Oh, good God. If we're going to have to split that many hairs, we got bigger problems.
Oh, look at the next number. Upon receiving notice to HHS specifying required changes in their training, they must also implement security awareness materials to HHS within 60 days advising to listen to Help Me with HIPAA podcast and develop a corrective action.
I was like, where are you reading this? I'm looking everywhere in this document. Like, where are you going? Oh, good Lord.
Anyway, I figured I'd stump you for once.
Yeah. Yeah, you had me. I was flipping back and forth. Like, where is he at? All right. And then as many of them also include, and we talked about this before, which seems like, I don't know how you would, this part to me seems really hard to make sure that you do. The 1 year period beginning on the effective date and each following 1 year period referred to as the reporting periods. Whenever you receive information that a workforce member may have failed to comply with the HIPAA rules, policies, and procedures, promptly investigate the matter. Yeah. And after reviewing and investigate, determine that a member of the workforce has failed to comply with their own internal stuff, they're going to notify HHS within 30 days that they had a violation of policy and procedure within their organization. So they have to tell them, here's what happened, the relevant facts, all the people involved, what things were broken or, messed with the failure, what actions were taken, everything. And then, they're saying, even if you think you didn't have any events, you got to send us some paperwork that says it. So they're making them sign off on the fact that if we didn't send you anything, it's because we didn't have anything. Right. So on all of those, somebody in charge has to say this is all true. So that's why they're doing that. But still, if somebody breaks the rules and you got to sanction them in a large organization, that happens all the time.
Mm-hmm.
So, it's whether or not did you break the rule? Because it says if you determine that they broke the rules, you've got to tell us about it. And you got to tell us all the details about it. Yeah. And then you got the annual reports. And if you fail to do this, then we get to go back and say, bam, $18 million. Well, it doesn't say that, but you know what I'm saying. So there's a lot in there, huh?
Yeah.
But we learned a lot.
Yeah, there's a lot of good information there. So, but I like the fact that it's not one of those breaches where you can say, oh yeah, well, I can see how that happened to some big entity, but these are not things that typically would apply to, a smaller entity. Whereas these absolutely would
everything on there could have happened to anybody.
Mm-hmm.
And we both know organizations that have a similar attitude from the leadership on how to take compliance seriously.
Mm-hmm.
So
we do know that.
But I think we've rambled on enough for today. We kind of hit our normal limits. It's amazing how we've managed to do that over a year.
Yeah. Mm-hmm. I'm just amazed we have limits.
Okay.
Oh, man.
Yeah.
So anyway, that's our podcast for today. Hope you enjoyed it and got lots of great useful information. And our charge for that will be a review on iTunes. So go on over to iTunes and review the podcast and leave us 5 stars if you feel we earned it. As always, we appreciate you listening. You can visit us on our website at helpmewithhipaa.com. If you want to ask us a question, you can do so right there on our homepage, and we might even feature it in a future podcast. Don't forget to share it out on social media. We do have several of you who do that every week. We know that because our social media outlets tell us that.
Thank you. We appreciate your assistance.
We absolutely do. It helps get the word out. So we appreciate it. So Donna, anything else?
Nope. Just have a great weekend.
Have a great weekend. Go Pokemon going.
Pokemon go. I'm finna do that right now.
Fitting. We'll look that up later. Oh boy. All right. For Donna and myself, remember, HIPAA is not about compliance. It's about patient care.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.